And I'd like to welcome Dr. Lauren Richardson for our presentation on public health risk assessment. Dr. Lauren Richardson has a background in veterinary medicine and public health with experience in large and small animal clinical medicine, food safety and defense, and infectious diseases. Dr. Richardson has supported projects in Africa, Central Asia, Europe, the Middle East, and North America. As Director of Science and Technology in the Merck Life Sciences Business Unit, she provides technical subject matter advisory support, training, and management for domestic and international work focused on laboratory, operational, and transition planning, risk and threat management, and health system strengthening efforts. Prior to this work, she practiced equine and mixed large animal clinical veterinary medicine in Virginia and North Carolina. Additionally, Dr. Richardson serves as a veterinarian in the United States Army Reserve. Dr. Richardson earned a Bachelor of Science in Biology from the University of Virginia, a doctorate of veterinary medicine from the Virginia-Maryland Regional College of Veterinary Medicine, and a Master's of Public Health from the Johns Hopkins Bloomberg School of Public Health, and is a diplomate of the American College of Veterinary Preventive Medicine. Thank you, Dr. Richardson, and I'll let you take it from there.
Thanks so much, and thanks so much for having me today. So I'll, as advertised, be talking about public health risk assessments. Okay, so these are our overall objectives for today. And after the intro, I figured it might be helpful to say a little bit about why I'm here and what I normally do on my day-to-day. So I work for American Company, which is an engineering and design firm, and we have a specialty in design for high containment laboratory facilities, which seems a bit of an odd place for a veterinarian to be. But a lot of the work that I do is in the operational planning for facilities once they're built. And this gives a good example of where that can be pretty useful. The blue line here is the normal laboratory floor that you see when you're in a high containment lab facility. Everything else is what the engineers are worried about. But a lot of the people who are providing the input on what should happen in the facility only understand that blue floor. So my job is to help the engineers and the designers to understand that communication between the end user and the actual facility design. And that translates really well into a lot of the risk assessment needs that we'll talk about today. So the themes for today's talk are there's no one-size-fits-all approach. Solutions should be feasible and sustainable. And this is kind of our theme song of the year, which is public health risk management solutions are not to be considered at odds with the process of the mission of the organization. So over the last year, we have expanded a little bit from our traditional client base of laboratory facilities and life sciences facilities and organizations, and have received a lot of questions from people in a whole lot of different fields. We've talked with universities, we've talked with other government agencies, high density facilities who perhaps are using office spaces or even some living spaces. And we've had a lot of questions and a lot of comments. And I think these are some of the interesting things that have come up, which really demonstrate that lack of understanding of what is risk, what does a risk profile look for an organization or a location, and what does that mean that we should do about it. And so I think these are some interesting questions. I'm sure you have all had a lot of similar questions and comments. I think maybe my favorite is, can you explain to me cycle threshold in layman's terms? I think there's a lot of folks who are hearing a lot of different things in the news this year that perhaps they weren't used to hearing before this. And so struggling to understand what is the so what of all of that data that's out there in the world has been a real struggle. A lot of the things that people are asking about and the good ideas that people are coming up with may not be appropriate to the individual situation. And so understanding what the institution's risk profile is and what their intended use of the space is very important. So I'll go ahead and leave this one, but I'm sure you can help me add to my list. So in terms of a public health risk assessment, vocabulary is really important. And I'm sure that a lot of what I'll be talking about is not unfamiliar to this group. So just as a reminder, when you're communicating with that audience who is perhaps not as well versed in the sciences, risk is really a probability, it's not a thing. And so that's very difficult for folks to conceptualize. In terms of risk landscape for public health, implementers for the mitigation strategies and operations inside a facility are not typically infectious disease or risk management professionals. They have a hard time understanding that the risk of one activity is largely independent of the risk associated with another activity. It's very difficult to help people understand that public health risk is assessed at a population level and not an individual level, though the individual behavior changes are what are impacting that public risk. And then public health challenges are often wicked problems. And for those of you who are very familiar with the public health field, this is something that has a lot of key determinants that cause a problem and a lot of outcomes that potentially feedback either positively or negatively on that problem. So I think this graphic really helps understand risk in context. These are problems at the global level. And while they're all interconnected in different ways, the risks are largely independent in their probability and impact. I think if you can see my little arrow on the screen, I'm not sure if that's actually showing up, but in the upper left quadrant, you can see that infectious diseases falls into something that the survey participants from 2015 would have thought to be fairly low likelihood, but of above average impact. And I'm pretty sure that after the last year, we would probably slide that blue dot well over into the upper right quadrant. So what does risk assessment for public health require? It requires an understanding of the environment, population dynamics, population health status, and behavior. And interventions are generally most easily implemented at a community or institutional level. So this is where we really had to help folks translate the information that they're finding from the public health agencies and from the government agencies and understand what that means for their individual institution and their individual communities. This is where it can be very helpful to discuss the behavior of people within the built and natural environment. Common challenges, I bucketed these into two things, gaps in understanding and gaps in capability. So what are those things that make it really difficult for the audience to understand the process for risk assessment and management? Most people don't have a basic understanding of infectious disease transmission. Even after all of the news this year, I've had conversations with very intelligent people who do not understand basic routes of infectious disease transmission. They don't understand the types of disease pathogens that cause disease or vectors that transmit them. The nature of the agent is something that even a lot of public health professionals don't understand, and we rely on those who are more expert in the pathogens themselves. They don't understand defining that problem. So understanding what is the problem that you're trying to address. And a lot of people end up trying to address things that impact the problem, but not the problem itself. They have a hard time understanding what individual interactions with their environments are. So it's very helpful to walk through a day in the life, and I'll go into that a little bit later. But to help understand what people do in the built environment and how they interact both with their space and with one another. It's tough to explain what the purpose of risk assessment is. It's tough to value something that is a probability in terms of cost and ability to procure funding. It's difficult to distinguish between individual and public risk. And then prioritization of risk mitigation strategies is really tough. Everyone wants to reduce risk to zero, and I think everyone on this call probably understands that you can't do that. And then we also have gaps in capabilities. So these are things that are reasons why you can't mitigate those risks easily. It's very difficult to understand how community dynamics and changing behavior can be done outside of that institution because people don't live in an institution. Communication is really difficult in terms of access and language. So can you reach the people who need to hear you, and can you explain it to them in terms that they'll understand? Financial resources are always limited, and they're often tied up in ways that can't be applied as usefully as as we would like. And then just generally the base level of knowledge in your audience tends to be fairly minimal when it comes to infectious disease. So what's the process? This is something that the CDC describes in terms of public health risk assessment. And it matches nicely to that of our familiar risk management process, where we identify the hazard, assess the hazard, develop controls and make risk decisions, implement those controls, and then supervise and evaluate. The important thing that I really like here is the stress for risk communication at every level, and the importance of the site information as informing both of those things. A lot of folks really want to take general knowledge and best practices. That's probably one of the most common requests that I get from clients is, what best practices can I implement? And while there are general best practices like washing your hands, that isn't really particularly helpful for most people because those are so well known already. So understanding the importance of the site information and in how that impacts the way that people interact with their environment and are potentially exposed. So in practice, we've got the definition here. I'm not going to read that one to you, but public health risk assessments are often used for chemicals, hazardous waste, heavy metals, and environmental contaminants, but not necessarily infectious diseases. And the EPA approach can be quite quantitative, which might not be possible or necessary in some of these situations, but the concept of quantification is really helpful in communicating to leadership of institutions and to people who are able to budget for and implement changes. So we'll talk a little bit more in a few slides about how we can do that. Why do we apply these tenets with infectious diseases? Focus is still on human health. The risk assessment process is delightfully adaptable, and the outputs and emphasis on risk communication are really useful. And how is this different from that kind of a risk assessment? It focuses more closely on those very specific site exposure conditions and the specific community health concerns and health outcomes data. And it's a lot less theoretical, so that we don't use sampling data, we use more of action-oriented activity. This is our very familiar risk assessment slide. So how do we look at this for biological risk? So this is something that we find really helpful in explaining to folks that we talk with about how do you determine what is a risk and what causes that risk. We talk about things in terms of threats or hazards, and I combine those two, and vulnerabilities. And if you add those two together, then you'll get a resulting risk. So what does that look like? So if you, hopefully people can see the colors on this slide, but if you match the color on the left to the color on the right, it tells you that what is the threat or hazard that is impacting that potential vulnerability that would result in a risk. So for example, if you have a power outage and a faulty generator, then you have the possibility for the risk of loss of power. If you've got a nice redundant power system available and potentially more than one, then that's potentially not a vulnerability for you. And so these are just different ways that we can look at both the linkage between that threat or hazard and vulnerability, as well as the directionality of that threat or hazard. So for example, if you have a hurricane coming, hurricanes are important when they are moving toward your facility, not away from them. And I know that seems pretty basic, but it also is a good way to kind of think about your risk profile in terms of likelihood of occurrence. This is one way that we can catalog that. And I find this very helpful for breaking this down for an individual facility. And I'm sure many of you have done risk assessments before, and perhaps you've used something similar. There are ways, there are pieces of this that are very helpful in prioritizing risk as well. So in the first column, you've got your threat or hazard, and you'll see that I've got the same one 3 times there, and that was on purpose. It's because we also like to link possible causes to those threat or hazards, and that'll be helpful later on in determining appropriate mitigation strategies. I find that it's very helpful to create a linear narrative throughout the resolution of a problem, because it helps you link back and say, all right, well, did I actually attack what I was meant to? Did I resolve what I was meant to? Or am I just kind of shooting in the air in terms of trying to do things that might be useful? So linking that for example, a negligent employee, this is what we would do in a facility, a laboratory facility. We say maybe a negligent employee who has access to the facility. That might be because we had poor screening and hiring practices that allowed us to hire somebody with an attitude that's not in keeping with the culture of our organization. It might be because we have a poor training program, and so the person isn't trained and doesn't understand how they're supposed to operate within the facility. It might be because we've got poorly devised access control policies, and we need to strengthen that so that we can avoid this employee obtaining access. So what are those consequences? Somebody might get to the place where they shouldn't. So next thing we do is we quantify that risk. And I think this is probably a pretty familiar table to everybody, but in terms of the left side, it's frequency, and the upper, as you go horizontally, you're looking at severity. We frequently get questions about, well, how do I know what's frequent? How do I know what's likely? And this is really it's specific to your organization. And so we just say, let's make sure that whatever we choose, it's appropriate to the organization, and we're comparing apples to apples. So for something, it might be that one occurrence each year is frequent. For a lot of our activities within normal spaces, or even within laboratory spaces, that's dozens or hundreds of times a day. Improbable might be on the order of many, many years. What about severity? Severity is really hard for people to understand and for people to categorize, and it's pretty tempting to put everything in terms of a very high level. But I think we find it really helpful to speak about this in terms of impacts to on-site and off-site consequences. So if you have a negligible hazard, that's something that is going to result in pretty insignificant consequences, either on-site or off-site. So it might be something that's an observation that you would want to follow up on and perhaps improve, but it's not something that is particularly impactful at a grand scale. Marginal, something that has moderate consequences on or off-site. And then the difference between critical and catastrophic that we draw is the potential for off-site versus on-site consequences. So we typically say, well, we might consider something of higher severity if it has the potential for greater impact outside of our organization or institution. So we go through and we rank those things in terms of frequency and severity, and we give them a risk class. Now we look at potential mitigations. And so mitigating each one of those things. And this is why in the original, we made sure to draw that to a possible cause or vulnerability so that you've got that linked through. The other advantage to this is that if we see that there are things that are all due to the same weakness within the system, the same vulnerability within the system, we can rack and stack that. So I will go through and I will sort for the institution. I will sort through and say, okay, well, do we have a lot of potential risks associated with poor hiring practices? And that might elevate that and help prioritize that more highly. It also allows us to figure out, okay, well, what are those safeguards that we would put in place that are going to result in the largest reduction in risk? So as we go through these things, some things will be more effective at mitigation strategies than other things, and we can prioritize those as to where we put our dollars. Once we've gone through all of that, we say, what are our actions and recommendations? And we assign it an action owner. And all of this might seem really logical, intuitive, but it really isn't. When you're talking to someone outside of the scientific community. And so linking those threats, hazards, and vulnerabilities to risks is very helpful in driving home the why of why you're recommending a mitigation strategy, quantifying the impact, and being able to help them communicate that to their administrators or funders. We also really like to label an action owner here, because then it tells you, all right, once we have this, what's our to-do list? Who do we need to go and make sure that we speak with? All right, so while an understanding those general risks is pretty useful, and an understanding of how that works at the laboratory level seems like it wouldn't tie very well to outside of the lab, it does help. And so understanding what are those different questions that the institutional public health risk assessment is going to cover. These are some common questions that I get prior to performing a risk assessment for an institution. So whether this is a university or whether this is an office building, what should my risk tolerance be? How do I determine that? How do I know if something's really a risk? What does it mean to think in terms of probabilities? How do you do the risk assessment? How do we know which risks are more significant than other risks? Who do I need? How do I know if it worked? And if I already have mitigations in place, then can we just delete those risks? And that last one is pretty key as you're going through this. It's very tempting for people who are doing the risk assessment to say, okay, well, that's an already mitigated risk, so we're going to just eliminate it. I strongly encourage you to leave all of those initial risks in your assessment and just describe the fact that those mitigations are already in place. Because if you remove them, it can allow you to work around your own, or it can allow the institution to work around its own strategies for preventing risk. We'll go back and say, we're going to evaluate the exposure. So now we're in the public health realm. And so this is an organization where we've got maybe this is an example of an office building. So we've got those desks over in the right side for group work. We've got a lot of different barriers, whether they are partial barriers or whether they are full walls. We've got areas of pinching within the environment. So where do people congregate? We see this a lot in buildings with a lot of people in a lot of broken out rooms. So things like schools, especially, I know it's been very difficult to get K-12 facilities back to work of late. But this is one thing that we can take a look at is how does the space, or how do people interact with their space? Are there ways that we can strategize movement through the space? Are there things that we can do to the space itself? So we take a look at those environmental challenges. What are the specific challenges to that individual workspace? How can you effectively potentially reduce the numbers of people? Is it physical distancing? Are there other mechanisms that we would want to use? Are there other measures that we would want to use in terms of dividers? And so this is one question that we got a whole lot with COVID is, can I just put up plexiglass, or can I essentially build forts at all of my people's desks? And I think understanding how the space works really illustrates this well. So for example, I had an architecture firm call and say, what do you think about adding plexiglass barriers in front of all of the teachers' desks in the rooms? And I said, well, how does a student address, or how does anyone walk up to the teacher? How does that teacher interact with the rest of the classroom? And so obviously the answer is, it doesn't do any good to have a plexiglass barrier if the normal interaction between individuals in that space is for a kindergartner to walk up and just get really close on the side of the desk to the teacher. So understanding what the intent of use is there is really helpful. And so that can be helpful in doing kind of a walkthrough of the space, or in doing a day in the life. And by a day in the life, I mean, pretend like you're a student. What happens when you walk in? Or pretend like you're a worker. What happens when you walk into a space? How do you address each of the areas? How do you move throughout the space? And what are those potential stumbling blocks that you might find? What are gathering places, natural gathering places, or intending gathering places? Have you identified any exposure points? So a water fountain or a copier is a good example of this. Have we talked about exposure routes? So if the disease of the day is SARS-CoV-2, then I think we understand how that one's transmitted. But we might also want to think about what are the other potential infectious diseases that we're worried about right now. And then have you identified a potentially exposed population? So do we have people who are entering our community who are not normally part of the community? Here we're just identifying and assessing the hazard. So then we determine the risk tolerance. The risk category really incorporates the frequency and severity of the outcome to determine that risk category. And so understanding what the risk tolerance is where we hit the context with impacts from other risks. The table on the right is an example guidance for preventing and managing COVID exposure in healthcare settings. It really demonstrates the necessity of reevaluating risk tolerance based on the surrounding environment, the institutional mission, and the potential activities in that space. I won't go into detail in that. I think we're probably a little bit fatigued of COVID precautions, but I think it's a good example. And it also depends on the surrounding and intersecting communities. So your normal community that's in the space, what communities come in and out of the space, and who have they been interacting with, and how do they typically interact with one another? When we're talking with folks, how much risk are you willing to accept? That's a really difficult question for most people to answer. And outside of a healthcare environment, it's very difficult to accept that you would potentially think about accepting any risk. And so understanding what it is against background. So what is the community rate of disease, or what is the risk within the community, can be really helpful in helping people to understand that there is no zero risk. So we'll use this as an example. So this is one that we talked about for a school. So what's the hazard? An infected student attending class. What possible cause? Why are they in the building? Because they theoretically, you should be home if you're ill. So you might be asymptomatic or have minor symptoms. What are those vulnerabilities that we're working with? Naive students, immunocompromised students, or teachers. What's the potential frequency of that? If we go over to our little table, I think we put it at a probable, assuming that there is a high level of community transmission. What's the severity? Potentially, we called it here critical, because in this case, there is the potential for high impact to outside of the institution, as well as very high impact to within the institution. And that gives us a risk class A. So we went through each one of these things and said, okay, so what's the next hazard, and how do we potentially look at some of those vulnerabilities? This was one that was brought up. The time between students hand washing is more than 1 hour, and that was given by one of the folks we were talking with. That's really not in itself a hazard, but we talk about that a little bit later. So I say, as you're thinking through these things, rather than discarding them, just write everything down. Make sure that we are not discounting activities or discounting potential hazards because we don't think they're hazards. So this also gives you a good idea of what's the vulnerability that's there. There really isn't one that you can associate. So potentially that's not something that we would really want to revise. So if the time between hand washing is more than 1 hour, that really doesn't mean anything. That was an arbitrary number that was given by the planners, that you were supposed to wash your hands at least once an hour, and that really doesn't mean anything or make any sense. What's the possible cause for that? You're working. You can't just break up activity to go wash hands, but there's really no vulnerability there. So it's something that we kind of discount. So these are all obviously for K-12 facilities or as part of this example, but it will eventually help people to prioritize. So next we look at those mitigations or techniques for addressing risk. So implementing those new procedures and policies based on those site-specific risks, vulnerabilities, and threats. So when we went through, we prioritized them based on consequences and severity. And as I said before, you can rack and stack them pretty easily when you drop this into an Excel document or a project file. We plan for and execute the activities to reduce risk, and then you plan for how to respond in the event of an unintended action. As we're going through, any of the things that we're putting in place as mitigations have to be practical and sustainable. What do I mean by that? Practical means you're not going to get up and wash every one of your kindergartner's hands every 45 minutes, which is actually something that was proposed. That doesn't make any sense because it is not practical. You would only be washing hands all day long. It's also not in keeping with the purpose of your institution. If all you're doing all day long is washing hands, it really doesn't help the purpose of the place, which is to be learning. So make sure that they are practical solutions. And sustainable. What do I mean by sustainable? This is really important as we talk about facility changes. So early on and very frequently, we talk with folks who are interested in making changes to the building structure. So either knocking down walls or putting in place new air handling systems. The questions that I would ask in those cases are, how much is that going to cost in the long run? Is this something that we are able to sustain year over year? If it's not, then we should really strongly consider how significant the impact of that mitigation strategy is. The other thing I want to know is it only useful if it is a very expensive intervention? Is it useful for more than one risk? So is it necessary potentially to redo all of your air handling in a facility that's 60 years old? Possibly not. That might not be very useful, but is it something that we might want to consider going in and at least bringing it up to current day code? I would strongly recommend that one. So understanding what those sustainable mitigation approaches are is important. And then in terms of other sustainable questions, is this useful long-term? Is it a way that you can actually interact long-term? So have you created individual bubbles that are completely against the way that you should be working as a group and the purpose of gathering in a space? Think about that long-term. So then we plan and execute those facility and engineering upgrades, and most importantly, monitor those new behaviors and operations. And I really stress, even with our designers and architects, we really stress the importance of behaviors and process of operations within a space, and emphasizing those things, whether through either visual prompts, and those stickers on the floors can be quite helpful, and they're not helpful because you really need to know exactly how far 6 feet away. They're helpful as visual barrier reminders. So I think it's often overemphasized, and I shudder to think that I work for an architecture and engineering firm, and I'm saying this, but it's often overemphasized the importance of facility and engineering upgrades and underemphasized the importance of behaviors. But this is something that is long-term much more useful, and then adapt those plans as needed. So what does that look like? So we carry this on through. In terms of distancing, we recommend the staging. We've recommended the staging of desks and scheduling breaks for different hand washing, or if you need a break to get out of your face mask, then don't do it in the room, but having appropriate breaks. And then training on procedures. And this was an example for this particular location, but it might be that we're training on how to wash your hands or something very simple. Training on any kind of behavior, even if you think it is a simple activity, is pretty important. What's the frequency of necessity is regular and recurring. So it's not complete. There is no single end point. And then when we go on through those things, we've maybe got some other options here. What is the monitoring approach? I think this is very helpful. How do you know it's continuing? So it's potentially a visual monitor. Right? We make sure that people are continuing to visually monitor that by just looking around and saying, all right, is this continuing to work? Might also be something that you're documenting via a checklist or a log. How do you know that it's continuing to work? You might want to pull information from reporting structures. So lots of different ways that you can monitor. What happens when a potential new risk is identified? And obviously this is a little bit of an eye chart, so I promised I'll break it down, but we find that something like this in terms of what looks to be a bit of a diagnostic algorithm can be helpful when people are not used to going through this process. So we start up in the upper left. Is the activity allowed under current jurisdictional laws or guidance? And it gives you the obvious choice of yes or no. And so it can be helpful and comforting for people to start from a place of clarity. So if there's a law or piece of guidance that is clearly published, that gives you confidence as you're moving on. You can check against that and then move on. And we keep going throughout this. So this is all in the assessment phase. So does it present a potential health risk? If no, just keep going with it. If yes, then proceed. And this is where, if you don't know the answer, can you describe that risk, vulnerability, or hazard? If you don't know the answer, then this is where we say reach out. And I think being told that you should reach out and seek assistance is very reassuring. There is an illusion that because there's so much information, everybody should understand it easily. That is unreasonable. I don't understand all of the information that I'm presented with on a daily basis. So that's why I seek out to smarter people who can help me with it. And so understanding, what does that circling back look like? And then if yes, then keep going with that vulnerability assessment. And then you can eventually determine that risk class. Once you've gotten to the risk class, we've got it in terms of like high, very high, moderate, and low. If it's low, it takes us back to the proceed, because that in our earlier assessment of risk categorization told us that it's fairly negligible in impact. So if so, then we're going to want to mitigate it. Can you mitigate it? If no, don't proceed. And so when I say don't proceed here, it means this is in kind of an additional, let's seek assistance. Let's figure out if this is really an important thing that we have to resolve, or is it something that we're going to have to put a lot more thought into? And sometimes that do not proceed means this activity perhaps cannot take place. And that is also ultimately up to the institutional leadership. Does the resulting mitigated risk produce tolerable levels? I think that one's pretty clear. Can you monitor and implement it? If you can't implement it, it takes you back up to the ask for help in terms of seeking assistance for helping to figure out how to monitor it. Can you communicate it? That's really important. You should be able to communicate any changes or in approach or any potential risks to an appropriate audience. And then if you can, then you proceed. And that last arrow that it's going up to on the left is taking you back to the establishing criteria and frequency for reassessment. This is a nice little graphic that also helps people think through what are those categories that we just talked about, understanding why they're important and what some of those things look like in terms of the assessment, which we've talked through now pretty intensely. The inform, so what are those risk communication pieces that are really important? What are those vehicles for continued dialogue and communication? Who are those stakeholders that you need to be contacting? And then the act piece in terms of implementation of those policies and procedures, any of those facility or engineering upgrades, and ongoing monitoring. So in terms of looking for sustainable change, infectious disease risks are not static. And so that emphasizes the importance of continued assessment and continued management over time. It's not a single point in time, which is really disappointing, I think, to most people in administrative positions, because they would like to be able to tick it off the list and say, we have accomplished this thing, we have the sticker, and we can go forward. So understanding that it is not a static process, and for sustainable change, we've got to make continued effort. They're not easily recognized, which is really tough for people to understand. So there's a lot of information that continues to pour in. They're not single event. It's not a one-time thing. They require interventions for communities and populations. And there are ways that we've talked about for continued propagation of knowledge through a community that can be really helpful in developing your communication strategy for an individual institution. And then they depend on individual behavior change and don't exist in a vacuum. General principles that we guide people to, obviously, adherence to state and local health and safety laws. This one seems obvious, but it's often something that people want to go to immediately to best practice it, and they skip over this step. And those things do change quite frequently. So just knowing where to go. Most of my risk assessments include an entire section on resources for continued update. You can go in and check where you are right now. So understanding what the frequency of looking at those things is pretty helpful. Implement recommendations while adjusting to meet the needs and circumstances of the institution and the local community. So what does that mean? Basically, if your recommendation doesn't work for your community, it doesn't work. And so making sure that you have the opportunity to gather feedback and you have a structure of communication that is kind of no fault, no blame. If it's not working for you, let us know, and we'll try and adjust fire. And then having the institution be receptive to that and understand that if it doesn't work for people who are participating, it just simply isn't the right answer. Guide the implementation by feasible, practical, and acceptable solutions that are tailored to the needs of the community. And then just generally encouraging those basic behaviors is something that will be continuing long after the pandemic ends. Talked a lot about the importance of risk communication. I think what you say and how you say it are equally important. And so we talk about risk communication in terms of understanding what the risk assessment, which is more science-based, and the risk management, which tends to be more policy-based, are. I like this logo very much. I stole it from FAO, but I think it's very helpful, kind of characterizing what that looks like. What are the responsibilities for the institution and the individuals? And if you divide them up and very blatantly say, this is what I expect of the leadership of this institution, this is what I expect of the individuals who are participating, it can be pretty empowering. Our job is to help identify the risks, put those mitigations in place, develop a plan for maintaining them, and then communicate what they are, what they're intended to address, and what the expected behavior change should be. So I think this last piece of what they are intended to address is very difficult for most people when they apply those behavior change or those policies haphazardly. And it's one of the reasons why we like to trace through those risk assessments in such a linear fashion. It's very easy to just say, well, we'll wear a mask and this is why. But then if people don't understand that, then they're going to mess with the mask, or they're going to take it off to sneeze, which is something I really love to see. But I think helping people understand why we're doing the things that we're doing is really useful in getting buy-in and adherence to some of the strategies that we use. And then the expectation on the individual is personal responsibility. And that's both for behaving as they are instructed to and asking questions when they don't understand. And that part of it really highlights the collaborative and iterative nature of risk management long-term. In terms of communication challenges, I think the public is a tough audience, and we're all probably pretty familiar with that. People tend to be a lot more concerned with risk that they did not accept themselves. What does that mean? I am much more likely to be okay with a very high risk of injury when I jump out of an airplane, if I chose to do so, than I am if I'm put in a situation where I'm exposed to a much lower risk level in terms of, did I walk into a supermarket? I might be much more irate about that risk because I didn't accept it. The hazard seems simple to understand, but it really isn't. We've got a nice picture on the right. It looks pretty, and everyone flashes this image up all the time, or similar images, because it gives us an idea of what we're talking about. But in terms of what does the public think, it's often just kind of a big bug. And so understanding that it's important to characterize that hazard and really explain what it means to you is important as part of the risk communication process. Individual risk is different than public risk, but individual behavior dramatically impacts public risk. And this is something that we have to harp on over and over and over again. And so distinguishing between those two, but also understanding that they are separate is tough. And then people have difficulty conceptualizing separate risks. So what do I mean by this? As we talked about that overall risk landscape, I think people say it's almost a mental triage that most do in terms of this is the most important risk in the room right now. This is the most important issue in the room right now. And so that's the only one I care about. And so the problem with that is if something tips up over that. So in terms of in the last year, we've got the anxiety associated with the risk to contracting infectious disease is very high. But as we started to see more strain on economic resources, then that became more concerning. And so it is very, very tempting for most people to say, the most important risk to me right now is this one. And so I will only focus on it. So having the ability to conceptualize those separate risks as being different from one another and perhaps equally or both important is tough to communicate. So overall, in terms of communication strategies that we find quite helpful, know your audience, know who you're talking to. I think it's really tough when we have these large conversations, and I've done several talks to groups of a few hundred, and you aren't going to hit everybody in the audience. You're just not. There are people who come with different backgrounds and levels of baseline knowledge, and some people will get a lot more than others out of everything that you say. So know who your audience is, and if needs be, break down into appropriate groups for further elaboration. Collaboratively develop those risk communication mechanisms. So by that, I mean, talk with your end user, your stakeholder, your community to understand what works for them and what doesn't, whether that's a pictograph or whether that is a newsletter or whether it is a question and answer session or some other radio blast. There's a lot of different ways to talk through these things and to communicate that risk in terms of mechanisms. Train on the new behaviors. Even if it seems really simple, it's not. And there are people who have baseline wrong knowledge that they will have to unlearn. I think we all learned how to wash our hands this year. I'm sure most people did know how to do that, but a lot of people didn't. So I think training on those new behaviors, even if they seem fairly simple, is helpful, especially when you get into things that are going to require either physical change in terms of how you operate within a space or adoption of new behaviors that are at odds with things that you have done before. It's really much harder to unlearn things than it is to learn them the first time. Focus on future actions. And this is what I've alluded to a couple times in terms of don't blame anyone for anything. It's not useful. Blame is very unhelpful in terms of either communicating risk or mitigating it. So focusing on those future actions and trying to avoid falling down the rabbit hole of whose fault this is key in actually getting to a solution. And then, like I said before, lots of different vehicles for dialogue and continued communication. Lessons learned. So the hidden challenges that we found this year, I think more so than any other, are the people who know you need assessment are not the ones who can authorize you to do it. I'm used to working with people in a laboratory setting, and usually when I walk into the room, they have asked me to be there. Sometimes they haven't, but most of the time they have. And so if you're there, then they know that they need you to be there. But a lot of time that the people who are on the ground and who are observing the problems are not the ones who can authorize the assessment and management of change. Getting the right people in the room is tough. So a lot of the time we find ourselves in the room with just the leadership or a single representative from an institution. And so it's really key to identify people from every different aspect of a facility or an organization and make sure that they are all present to weigh in on different challenges, different potential risks, and their perspectives. I usually say the person who's walking on the high wire has a lot different understanding of the risks associated with his activity than does the person who's insuring him. Financing is limited and funding streams are often constrained or linked specifically to different types of activities. And so it can be tough to get creative in terms of assessments. And people like numbers, even when they don't understand what they mean. And so helping to rack and stack or to assign number values to some of those risks and mitigation strategies is really helpful in communicating with leadership or decision-making authorities. In terms of execution challenges that we found, cultural norms are dynamic. We talk about the culture of a community or a culture of an organization as though it is a static thing. This is what my organization is like. This is how we've always been. It's not. And so as we've seen over the last year, the cultural norm of how close we physically stand to one another has changed. The cultural norms associated with appropriate behavior on a Zoom call has changed. So I think we can, if we explore what that looks like at a behavioral level and how we interact with our environment level, then we can see that is tough when we get to the execution stage, because people tend to accidentally work around our interventions. Next challenge that we really found is that dissociating control interventions from punitive measures is really difficult when people are scared. What do I mean by this? So one example that was given was, well, what do we think about if someone shows up and they aren't able to, and they're sick. We don't know if they're sick because of COVID, but they have a fever. And what do we do at that point if we can't get somebody to pick them up within 45 minutes? And the thought was, well, I'll call an ambulance. Well, that's not helpful. It's not necessary unless someone actually needs to be in an ambulance. It's punitive in that you're punishing the parents or the authority figures who will actually have to pay for that activity. It's absorbing resources. And so that's just one example, but I think it's really important to make sure that we're doing interventions that are intended to mitigate the problem, not that are intended to punish those people who are impacted by it. Behavior change is hard and consistency is imperative, and it is so difficult to maintain a high level of vigilance over time. Adapting lessons from the lab. How do we do that? Start from where you are now. It doesn't matter where you are now. It doesn't matter whether you have done all of the things well or you have done really poorly. Just start from where you are. Don't think too hard about what we should have done before. There's time for that in the after action review at the end. Understand your audience, integrate early and often, get as many people in the room as you possibly can. Empower those end users to communicate and give them different mechanisms to do so that work for their schedules, their time, and their communication styles. Understand their challenges and be respectful of those. I think here I talk a little bit about empathy and compassion being really important in understanding how public health changes are made. And then again, no blame allowed. What can we do? Assign responsibilities. Everybody's got to have a ringleader. Most things are not executed by committee. Some things are, but it's not very efficient. Build those multidisciplinary teams to make sure that you've got all of the perspectives in the room. Identify resources and mechanisms for access. So where can people go to get more if they don't want to talk directly to you? And then develop processes as well as processes for changing those initial processes. Hold functional training. So that means not just reading PowerPoint slides to somebody, but actually doing the thing. And then using as many modalities as possible for communication. I think the real key here is leaders at all levels have to demonstrate the behaviors that they expect in their populations. And that's really tough to get people to do. So I'll go ahead and pause here and see if there are any questions from the group. I'm gonna stop sharing so that I can see.
One question that we have received, I believe it would be a very broad question, but would you have any examples of a risk assessment process or possibly a resource for risk assessments for small animal veterinary practice?
Yeah, I think there's a couple ways that I would suggest you address it. And I think one of them is, and I'm happy to, if you reach out directly, I can get you a template for your use, if that would be helpful to you. I think this is an adaptable template that you can really use for anyone. One of the things that I would suggest is that you walk through the facility and you address it piece by piece. And I'm happy to go through kind of a case study of what this looked like for one facility, if that would be useful, just kind of as an example. I think it's something that you can do for a small animal facility. There's a lot of good resources of, as I mentioned before, best practices, which are a little bit not institutionally specific, but I think that it can be useful. In terms of process, let me see if I can get this to project. So for a small animal facility, you do pretty much the same thing. You do it for a small animal facility or a large animal facility or really a public space of any kind. So just like we talked about before, what's the hazard that we're concerned about? That one's pretty obvious. I won't go through that in detail. But then this is an example for what we did for K-12 facilities. We talked about how do you get there? What about when you are there? And and what are all of the different surfaces and spaces within the building. So what I would suggest is that you take the perspective of different individuals who use the space. So for example, take the perspective of a client. How do they interact with the facility? They arrive, they drive up to the parking lot, they enter the front room. Who are the people that they interact with? And you'll find that as you look at what they touch, where they go, where they congregate, you'll notice all of these different things. And then you would want to take it from each one of the employees or staff members' positions. So your receptionist, who do they see? Who are they in contact with? Then you take a technician's perspective, the people who are working in the kennels, the veterinarians, how are they coming in contact with one another? And so I think understanding how people move through the space is very helpful. So what I would recommend doing is taking a layout of your facility and literally drawing or tracing how you move through that facility for each person. And you will see pinch points, you will see different areas. I think you'll end up being pretty robust when you do that. And then, as we talked about before, kind of prioritizing those strategies is the next piece of it. So hopefully that was helpful. And I can keep going with this, but I think it's this is an example for K-12 facilities in terms of like, what are those different spaces that they move through and how do they interact differently in those spaces? And you can equate that to what you would do in a small animal facility. It's a little bit tougher when you move outside of an individual facility onto a farm, but I have worked with one large animal practice who we talked through what does it look like in terms of how do people get to the farm? Do you drive with your technician? Do you all take separate vehicles? How do you operate together when you're in a shared space on a client site? That can be really complicated. But I think there's a lot of different ways that you could go about mitigating some of those risks, and just understanding what they are is the key to picking the right solution.
Okay. Would you have time for one more question?
Yeah, absolutely.
Okay. An individual wrote in, a sometimes discussed fourth element of the risk framework is risk evaluation. Do you have any thoughts on this?
Yeah. So I think we probably called it different things, but I think that a reassessment of those risks is probably what you're talking about. So making sure that what you did was appropriate. So did it work is the question that you're trying to answer. In terms of did it work, I think that's where understanding what those metrics are for evaluating whether you reduce the risk. So theoretically, you did by applying that mitigation strategy, but then you've got to figure out what is the appropriate, and so this is why we kind of go through it in a linear manner, but how do you tell if that specific thing actually did what it was supposed to? Can be really tough. So there's different ways that you can do it. I think getting metrics that are going to give you the solid answer is a losing battle in most cases when you're talking about public health risk, simply because it's too difficult to untangle them from one another, right? So if you did a whole bunch of different interventions, how do you know which one worked? I think come up with a bunch of different monitoring strategies. So like watch the way that people move in the space. Did you actually change the behavior? Are you seeing interactions that are different among people? Can be very helpful in terms of actually putting metrics to did you reduce that risk? It's tough in terms of monitoring, did you reduce the incidence of disease? And that's for a couple reasons. One, at the institutional level, you typically don't have enough numbers to make that a question that you can answer. And so it can be a little bit frustrating, but I do think finding different ways to evaluate those individual strategies is really important.
Well, we are just a few minutes past our hour. There are a couple more very specific questions that I will pass on to Dr. Richardson. Allow her to answer those by email, if that's okay with you, Dr. Richardson.
That sounds great. Thanks so much.
Okay.
And I appreciate everybody's attention.
Yes, and we had a great attendance today, almost 200 attendees, which is a very positive view of our program here, our continuing education program. Everybody else that's still on, I encourage you that if you have a topic or something that you would like to present at a venue such as this, please contact our Continuing Education Committee, the ACVPM's Continuing Education Committee, or you can contact me at admin@acvpm.org, and I can provide the information to you. We can't do this without volunteers, so we encourage anybody that's got a topic that they feel would be appropriate for continuing education. We take care of all the race information and race submission, so we are always searching for volunteers. I will close today's session again, but I want to thank Dr. Richardson. Fantastic presentation today, and I want to thank everybody that attended and made this CE event a success. Everybody have a great afternoon and stay healthy.